All right. Well, everybody, welcome. Um, let's say number 13. Happy Fiesta. If you don't know what Fiesta is, San Antonio, it's a big fiesta down here, big party. We eat a bunch of food, drink a bunch of beer, just hang out, celebrate the culture. Come down if you're ever in town. We got a special guest this evening, my buddy Jon from CrowdHealth. Jon, how's it going?
Doing well. Thanks for having me, Gabe. I appreciate it. First time in San Antonio, so I got a chance to walk around the river, walk before this, and yeah, beautiful town.
All right, welcome, Jon. You want to tell everybody a little bit about yourself, how you got into Bitcoin, your Bitcoin stories, favorite question to ask?
Definitely. So my background is I grew up in the Chicago area, studied economics at Northwestern, completely Keynesian fiat economics. They don't talk about Austrian economics, no mention of Bitcoin other than, Silk Road in those years. I graduated in 2015. Worked for a few years in healthcare consulting, so helping hospitals and health systems with their strategic planning, health insurance for HCSC, which is actually Blue Cross Blue Shield of Illinois, New Mexico, and Texas. So I've experience in the payer space and then in medical supplies. Did double masters in health economics, so sort of deep in the healthcare space for most of my career. And then really in 2020, I think with a lot of other people, sort of waking up and seeing what was happening with the COVID response and um, getting married and really starting to look around and say, hey, question what is money, and understanding that, what I've been taught in school, isn't the only story or the only reality that's out there. So really by the end of 2020 and then digging in 2021, just learning about Bitcoin, reading dozens of books, listening to the podcasts, and I'd say more from a distance, just getting my hands on what I could, Bitcoin Standard, layered money, price of tomorrow, kind of just understanding Austrian economics, and then had a chance to go to adopting Bitcoin kind of my own accord, November 2021. And that was really the first time I was meeting Bitcoiners in person, talking about, learning about the Lightning Network, what was happening, what's possible. I've always loved traveling and exploring, learning different cultures and different communities. So seeing how they were using Bitcoin down there was really inspiring. And I left Medline and was traveling with my wife in Africa, did a yoga teacher training in Bali, running a marathon in Jerusalem, and kind of all throughout this time and exploring, going further and further down the Bitcoin rabbit hole. So I'd say, really with the excitement of the last bull market in 2021, seeing the price go up, riding it back down, but each day, I'd say my conviction just continued to grow because I had a deeper understanding and not having a technical background, but reading Mastering Bitcoin, getting a better sense of really how the network works, understanding energy as well. And I've been thinking on my own, say, here's the healthcare industry that has one of the biggest in the world. If you look at $4 trillion a year being spent on healthcare in the US, a quarter of it being administrative, and half of that waste, this is something Bitcoin can and should fix, right? If you have sound money, it completely changes the incentive structure. So all of healthcare is built on these fiat incentives that we can get into. But then I stumbled upon CrowdHealth last year, hearing Andy Schoonover, the founder, on with Marty Bent and Jimmy Song, and seeing how in this crowdfunding model we could now save in Bitcoin and really have, and what does healthcare look like on a Bitcoin standard? I think it looks a lot different. So having moved down to Austin with my wife in August and interacting with the community in Austin's been amazing. Having a chance to travel and speak at some other Bitcoin conferences in Charlotte, Nashville, again now down in El Salvador, and really showing how healthcare is an industry that really is ripe for disruption. A lot of the Bitcoin innovations obviously started in the financial sector and with mining and the energy sector, just with being more naturally where Bitcoin is. But with value transfer in our whole economy being built on the dollar, you've had certain incentives, and I think you see the detrimental impact of both food, big food centralization, and then also with big healthcare being so centralized.
So with CrowdHealth, you can explain a little bit about what y'all do and like what y'all's mission is? Y'all are changing the game when it comes to healthcare, man. It's pretty mind blowing.
Yeah, so CrowdHealth is an alternative to health insurance. It's not health insurance. It's really providing tools for individuals to take control of their health. So it's a crowdfunding model, people helping each other out with their bills. We negotiate directly with providers to get better prices. And then you have the option to save in Bitcoin. And really breaking that down and how it works and some of the other tools is really navigating the healthcare system can be complicated, difficult. So you have a care advocate that helps you navigate your healthcare journey, access to telemedicine, discount medications and labs. So really all the tools and services you need to be, as we say, delightfully uninsured. Because you think, we've been trained to think, oh, I need health insurance. But health insurance has gotten so expensive to the point that people are spending more on health insurance than food. It's just completely backwards, right? And you have a few big companies. United Healthcare is the 7th biggest company in the world by revenue. So they're incentivized for the price of healthcare to continue to go up. And a lot of Bitcoiners have probably seen, that chart in the last couple decades. Healthcare is up 300% pricing wise compared to, it was very government regulated. And the key, really the core of the value of why CrowdHealth works is really bringing the cost and the actual price of healthcare down. It's not really a free market. When you're insured, you give up your agency to negotiate the price, right? So the health insurance plan is a third party, right? You're sharing that risk, you're pulling the risk, and they're pre-contracting rates with providers. But they're only allowed to make a 15% profit. So for every $100 in premiums that you pay the insurance company, they have to, by law, spend $85 on medical care. So what does that do? The only way for their bottom line to go up is for the top line prices and premiums to go up. So they're negotiating with the hospital system, who've also had a ton of M&A and centralization, and they don't even really understand their own costs of production, right? And complete mess, right? Trying to navigate, go to different places. And they're sort of in cahoots together for prices to continue to go up. So when you walk in as an uninsured individual, you can actually negotiate a fair price. So we're getting 70% off bills over $1,000. So even those big bills that people think, insurance covers, well, insurance, 250,000 families a year go bankrupt due to medical bills despite having health insurance. So really in this model, it's bringing humanity back into healthcare. I'd say is very much the mission of CrowdHealth. Because for thousands of years, when humans got sick in your community, you rallied around that person and helped them. So with the crowdfunding and how it works is, it's $175 a month to be a member of CrowdHealth, $40 is a subscription fee, and then the other $135 you're saving in your crowdfunding account, which is building up over time and being used to help pay for other people's bills. And the Bitcoin piece is that after 4 months, 3/4 of that monthly contribution is now being saved in Bitcoin. So our members have been stacking throughout this bear market that went into effect in October, and are up 50%, right? And that we didn't know obviously what's going to happen with the price, but the idea is with Bitcoin, there's only 21 million Bitcoin that will ever exist. We have a store of value now that we can rely on, where in 10 years, if you need a surgery, we've been storing some of that value in Bitcoin. Whereas, Medicare is going to run out of money in 5 years and, they can just print more money. So if you have a health event, you pay the first $500 of that health event, and then anything over $500 goes out to the community for crowdfunding. So, and actually I had a recent accident and broke my nose, had some stitches, and for the surgery, we shopped it around, and I paid the first $500, and then we went out to the community, and let's say the bill is, it's for $8,000. I pay $7,500, and then we ask another 75 people for $100. Hey, will you contribute $100 to my nose surgery? You can say yes or no each time, but you get a generosity score based on your track record of giving. So now you're incentivized to give, because since June that I've been a member of CrowdHealth, I've given to others, so others will see that my generosity score is 100. There's no reason for them not to give. And then the key point, getting back to that medical loss ratio, is instead of $85 out of every 100 being spent, what we've seen for our members is that for every $100 people are saving in their account, about 35 is being spent on medical care crowdfunding. So that 65 is not CrowdHealth's profit, that's member savings. So that's really where the value comes back to the member, and you have someone that you can talk to really have that support, and then a community to help crowdfund those bills that for whatever comes up in your life.
I want to go back to how you were saying, people are stacking Bitcoin when they go through y'all. And I think what's so cool about CrowdHealth is now you have insurance and you're putting your wealth into this pool of money that it appreciates over time. Whereas, with traditional health insurance, you're literally throwing dollars at it and you never get anything back. It just melts away. From what I understand with y'all, like if I had like $3,000 saved up in my Swan account with y'all, and if I were to step away, I could just pull all my value out of that pool of money and take it with me. Exactly. I know you can't do that with I won't name any names of any other insurance companies, but you can't do that with anyone else, And
exactly, it's money you're never getting back.
And the thing too about that was, I just did some taxes. My taxes, I just did them. Man, I couldn't believe the amount of money I paid to the insurance company for insurance I didn't even use. And it was just all gone. They just ate it up, boom, nothing back. Yeah. So. Yeah,
the problem with that too is then you're not also really incentivized to take care of yourself as much, right? So in our model, you're technically taking on the risk of those bills, but now we have people who are actively, especially with Bitcoiners, looking at, hey, what am I eating? Where's my food coming from? You talk about beef intelligence, health intelligence, food intelligence that Texas Slim talks about. We partnered with them for some events in the beef initiative, thinking about what you're eating, is really going to determine your health and needs down the road. So that's really all connected as well. And then you look around the room and it's people who are actively working, trying to get better. And that's one big part of people's lives. We're human. We're always going to need to learn and take care of ourselves and our bodies and our minds. So I think having a different model compared to really fiat food, fiat science, where again this incentive structure for prices to just go higher and higher. I mean, you look at the U.S. compared to other countries, we're spending $12,000 a year per capita on healthcare, and our life expectancy is in decline, right? Health and wellness, 6 in 10 having a chronic condition, just continue deterioration really of the health of the population. You look at underlying and what the incentives are for big food, big pharma, and having just a sick care system, heads in beds. And I've worked in the traditional system, seeing, what the incentives are, and or more operations. And you have this really perverse, you have the supplier induced demand as well, where they're going to get fee for service model. They get paid more for doing more services. And since you're not really the payer for the service, you don't really know the difference, right? You have this asymmetric information, and now more is being done, or you're getting overdiagnosed even. And so you have more and more tests and things being done that aren't really beneficial necessarily either. So I think as I've dug into healthcare and then learned about Bitcoin, it's just, I really think that there's so many aspects of healthcare as well that so far CrowdHealth has tackled right now, this sort of replacement of insurance, but completing the loop, and something we're really looking at is how can we build all this on Bitcoin? Accepting payments, doing peer-to-peer crowdfunding, using Bitcoin and the Lightning Network, and then eventually paying doctors using Bitcoin. 6 to 10% of every transaction in healthcare goes to the electronic medical record billing company. So you think Visa and MasterCard are bad at 3%, it's even worse in healthcare. And that can be the difference between, making and losing money for a year. You look around, you don't see as many independent doctors' offices anymore, right? Because they're getting squeezed. It's difficult for them to keep running their business, so they get bought up. Or now you even have the insurance companies buying providers and buying the pharmacy benefits managers, and they're negotiating with themselves. I mean, it's not, it's a complete joke. So we're spending 3 times more than other countries, and I think you just see that stress and anxiety and poor health manifesting in a lot of different ways. That, Bitcoin is only one tool, but I think if that tool is the baseline of the way we interact and, have more of a value for value model. We were chatting about the podcasting model and being able to stream sats. Well, now with value for value in healthcare, it's instead of your doctor having only 7 minutes to talk to you, right? You've been because now they need to have 15, 20 visits a day for this hyper efficiency model. What if you actually could pay them, what's the fair price for an hour of their time or 30 minutes of their time, and then kind of realign, restore the physician-patient relationship as well.
Yeah, I know, touching on that, like if you go through an insurance, well, if you go through a third-party insurance, they limit the doctors on what they can do. Like how you were saying, 7 minutes a day. That only happens because insurance says, hey, paying you this much, like you can only do this much per patient, right? So I thought that was pretty crazy. And then going into the health, you see America, like, what do we have, like 60, 70% obese or something like that?
It's
up
in the
there?
40s,
40s?
40%,
Okay,
40, 50%, yeah, 70% obese, overweight. Yeah, it's
So like they blame that on overabundance. Oh, there's more money, there's more food. But if you read Saifedean's Fiat standard, he goes into Fiat foods and talks about like how the food pyramid, everything we've been taught this whole time, it was all bought by big pharma, big companies back in the day. Kellogg was on the board of directors for Harvard, and Harvard was putting out all these papers about why meat's so bad for your heart. Eat more sugars, eat more grains. That's why we look at the food pyramid now, and your base layer is grains. But grains don't have all the nutrition you need. All the nutrition's in animals, the fats, everything our ancestors used to eat. If you go around the whole world, before transportation was so big, you had all these different tribes eating animal meat. There was not one tribe of people, all vegetarian. And we've been tricked into thinking like, okay, eat the fake meat, eat vegetables all the time, fruit. And when you start eating like that, you eat more grains, you're malnourished. So what happens? You end up feeding that malnourishment with junk food, sugar, something fast, something I can get right now. And even falls into like the farmers, how Slim and them talk about that high and low time preference. We're at such a high time preference, everybody needs it right now. We all need everything right now. So like all the soil that's being produced right now and all the food that's being grown in it, it's artificially tilled. And then they throw artificial sludge on it to re-nourish it, to grow more food on it. Well, every time you do that with the soil, you take out the nutrients, you kill all the matter in there. Whereas back in the day, why the food was so much better was because you had to, grow your crops, you let the animals graze all over the field, butcher the animals, you take the crops, and essentially you would, clear out that plot of land, you would do it a couple times, clear it out, move on somewhere else, and let animals come back and graze on that property. They would, fertilize it, plant life and everything would start growing. They would reproduce that matter, that organic matter inside the soil, giving it the nutrients it needs. But we're on such a high time preference. I need it now. I need it now. What's the cheapest thing we produce now? That's quick and easy to grow. Corn. That's why you are seeing like corn syrup, all these corn products all over the world now, right? And it goes into like the Sugar Act. Like that's why we stepped away. That's why if you travel outside the U.S., you'll see like you always hear like Mexican Coke tastes better than regular Coke.
Yeah.
Right? You have all these foreign candies. The German chocolate tastes better than American chocolate. Well, it's because they're using real sugar. And we've stepped away from that. Now everything's got corn syrup and everything's artificial. It's because it's a high time, it's easy to produce. And that falls into the healthcare system because now those same chemicals and those same artificial things are causing people health problems in the future. So they're not going to fix it.
Yeah, not only the future, but the present. It's been a 50-year experiment. What WTF happened in 1971, and a lot of these changes in the monetary system also is aligned with a lot of the misinformation, really attack on eggs and cholesterol, or in and out you see the replacement of animal fats with seed oils, and it's really if you look at the process of those, and it's industrial sludge that's being put in everything, and even if you look out there isn't great data on it either way, but I think the proof is in the pudding and you can see the relationship of increased consumption of seed oils and all this poor health outcomes happening in the last 50 years. And we actually, CrowdHealth, put out a call a few months ago for medical advisory board of Bitcoiners, so Bitcoin docs around the country in different specialties, to try to help us understand a lot of these questions and how to help educate our members. So we have a couple dozen docs on our medical advisory board that we're chatting with, and we're going to start bringing more to the forefront and through a podcast and other. Yeah, we definitely get to questions. And just help educate our members, because you can't get your information from the traditional sources, so you need to critically think yourself and understand, and even do some testing, like how does it feel to consume certain foods or go on a carnivore diet or animal-based diet compared to eating most of the breads and pastas or other things that every body is different, and just being able to test and know. But a lot of the challenges too, we have food deserts, right? And it's hard to, as even with beef, 80% of beef production is controlled by 4 companies. Just like I'm saying, health insurance is 4 big companies. Like, you just see these centralizing factors. So really the movement with CrowdHealth and aligning with Bitcoin is decentralization. So we have over 3,000 members across all 50 states, or we don't have to be in the same place to support each other in a community from health paying for a bigger bill, right, perspective. When before, or even the way that health insurance plans were designed, was coming out of the World War II and wage freezes in the 1940s, and this was another benefit that employers could provide that wasn't technically an increased wage, but what's happened is now that's come out of your wages. So for an individual to be covered, it's $8,000 a year, and for a family, for the premiums are $22,000 a year. And employers are paying 75 to 85% of that. So if you're at a company and half the country gets their health insurance from an employer, you don't even realize that that's actually coming out of your paycheck, whether you like it or not, or whether you're using healthcare or not, versus getting to decide. And what I've been telling companies and startups the last few months is really, companies up to 50 don't have to provide health insurance, right? But to attract talent, you need to provide a benefit. But now you could give a health stipend, give a few $100 a month, and then the employee gets to decide what's the best use of that value. Is it joining CrowdHealth? Is it just going and getting a massage? Is it buying better food, right? So now at least that's extra income that as a business you can feel good about. Hey, here's a benefit, and that you can take care of your health with this value, instead of both of us throwing it away to this insurance that we think we need, but maybe we don't.
And the other thing too about that is, like, our current health system right now, everybody's so used to getting free handouts, right? So now you have perfectly healthy people paying this insurance, even though they don't go. Guess what? That insurance pays for other people that have poor health habits, poor eating habits, use drugs, smoke, don't work out. I know with CrowdHealth, since it's majority Bitcoiners or all Bitcoiners, we're way more focused on, like, our health, because health is wealth. You always want to last as long as you can, right? But I know with y'all, what's so cool about it is it's more of a health conscious individual that y'all go after. So that way it's not like, oh, I'm just paying for everyone else that has poor eating habits or poor health habits in general.
Yeah, that's exactly right. So at CrowdHealth, you can't be over 260 pounds, you can't be a smoker. If you have a pre-existing condition, you can still join CrowdHealth, but you can't get crowdfunding for that condition in the first 2 years. And then after 2 years, you can get up to $25,000 a year in crowdfunding for that condition. And we actually just had someone join that has type 1 diabetes, and he's gonna save, he did the math, and he's saving 10 grand for his family for being in CrowdHealth compared to his traditional insurance, despite all the medications and things he needs to do, for his condition. So I think that avoids some of the moral hazard and really of traditional insurance, which is the point you were making, that if someone else is paying for it, the payer, the provider, and the consumer are all different, you're relying on others, or you're not as incentivized to take care of yourself really in that model, because someone else is going to be paying for my week-long, month-long hospital stay, or continuing to go back to, you see a lot of recurring recidivism, people coming back to the ED, emergency department over and over again, and just putting that strain on the health system. And it's rough, it's hard to see too, and just the underlying challenges of, despite, Medicaid now, even public insurance, government insurance, there are almost 100 million people on Medicaid when it was originally designed for low income and individuals, but it's just kind of continued to expand and expand. And having worked in Medicaid before and seeing the poor service and even how these plans were losing hundreds of millions of dollars a year, or people on Medicaid are also getting denied service at certain places because the government pays such a low rate to providers for those individuals compared to, and so where the providers make up that difference, employer-sponsored plans. So employers are paying 250% more for the same exact service at the same exact place than the government pays. So you just sort of have this imbalance either way that I think what CrowdHealth is doing and having more and more people joining this model, the stronger the network gets and the more providers that love it and then say, hey, I want to take care of more CrowdHealth members. You're paying cash on the day of service instead of me waiting 3 months to get paid by insurance. So it's really a win-win, just like with Bitcoin, you eliminate the need for a bank and a trusted third party to store your value. With healthcare, you can get rid of the trusted third party of an insurance company to pool this financial and health risk, but still have the benefits of really what insurance was supposed to be designed for, which is if something catastrophic happens, you have other people to help you pay for this. You're not going to get put in ruin. So far, all the bills, have been crowdfunded, and even having some serious couple cancer cases, NICU babies, and others that are really helping to navigate and have more of a personalized healthcare journey instead of you call a new call center and someone's in India and they have no idea who you are, and every time you're trying to explain what to do. And that's just a reality of the centralization. A lot of those services is what's gotten outsourced. So you don't have good customer service traditionally in healthcare.
Well, I know a pretty cool story I heard, or testimony from Andy, was why he got into it. So Andy, the founder, his daughter needed hearing tubes. I don't remember how old he said she was, but he said it was an $8,000 procedure. So he was like, okay, well, I have insurance. I'll pay for it. Well, his insurance deemed it an unnecessary procedure. And he was thinking like, I pay y'all. How is it unnecessary? She can't hear. So essentially he had to pocket up that $8,000. And that was the moment that he was like, this needs to change. That's when CrowdHealth came into be. Hearing that, it was kind of like, wow, I didn't know that they could do that type of stuff, especially if you're paying them. Another thing about all this is like how you were saying the doctors get paid. I thought that one was really cool also, because I didn't know it takes 60 to 90 days for them to talk with the insurers, get all the paperwork done. I know with y'all say doctors are starting to love it so far because they get paid that day for whatever procedure.
Yep.
And that's it. They'll take the discount because they don't have to deal with all that mess, and it leaves them, with 30% more time to do whatever they need to do with their day instead of paperwork and phone calls, emails.
Exactly. And that's really the value coming back into the system. And for bills over $1,000, we're getting 70% off. And, even routine care, you get an annual wellness visit where you can get crowdfunding towards that. Choose the provider you go to. And also one of the benefits is no more networks. Generally networks say, oh, who's in and out of network? Well, now there's no more networks. Again, we just go and have a handshake and say, hey, what's your fair price? So it might not be as low as what the government's paying, but it's definitely not going to be as high as this insurance plan. So it's somewhere in between, but we're still getting a lot of value then back to our members. And the docs can have more time to spend instead of having, we've got 3 admins for every doctor now, right? We have doctor shortages, nursing shortages, and more time spent on the paperwork, and having all these claims denied, 1 in 5 claims denied. I mean, every metric and way that you look, it just gets more and more broken. So I personally don't believe there's a policy shift or change that is going to fix the system. Like, it really needs to be a parallel system that's built, from the ground up. It's more decentralized and has individuals opting in, similar to Bitcoin, to say this is more of a lifestyle. And yes, it might take a little bit more work initially, or I'm taking more on responsible. But just like with Bitcoin, you have 12 words in your head. You can store, all your wealth, and if you lose it, you can't go and reset your password, right? So there's some responsibility there. But I think everyone's realizing that they can take control of their health. And one big thing I've been studying also as I've dove into Bitcoin is yoga and yoga philosophy, and getting a yoga teacher training. I think there's a lot of similarities as well with yoga and Bitcoin, and having really the foundation of it being energy, and knowing in the voluntary nature, and that you can always tap into yourself. And the Bitcoin network you can always tap into as well. It's voluntary. It doesn't discriminate on anything, right? These are the rules without rulers, you can participate. But it's also proof of work. You're not going to go upside down or learn some of the asanas, the movements, but really having it be a path towards that individual sovereignty. So I think that being related to your breath and your health and kind of how you move throughout the day, having those principles and really studying Bitcoin. And I think particularly meeting other individuals who are curious and wanting to learn around the world has been part of the best part of the journey for me.
That's the beautiful thing about it is Max Kaiser always says that you don't change Bitcoin, Bitcoin changes you. It's crazy to think that a hard money can get you to change your eating habits, change the way you incentivize other people, how you treat other people. It touches all these circles, and that's the whole point of these meetups. That's why we wanted to bring y'all in, because we wanted to touch on how Bitcoin touches the healthcare system. But yeah, it's been a wild ride so far. I just want to say thank you for coming, Jon. You answered a lot of questions. I wasn't expecting that many, but there were some good questions too. But yeah, appreciate it.
Awesome. Thanks, Gabe.
Thank you.
Thanks, everybody. I really appreciate it.
I forgot to special gift for everyone, so we got these little Fiesta medals. So I'll be passing them out here in a little bit. Appreciate all y'all for coming out. If y'all are hungry, anybody thirsty, please, free food, free drinks.
And take a CrowdHealth keychain too, the little orange
free
pill.
swag over there.
More Bitcoin.
Swag over there as well. Thank you.